Hello everyone and welcome back to my YouTube channel Dr. Happy Vagina, and this is a channel that educates about women's health. And in today's chapter we will speak about Botox of the urinary bladder. So we don't use Botox only for cosmetic reasons, we also use it for medical reasons. And one of the medical indications is urge urinary incontinence. And urge urinary incontinence, it means that the bladder, here is the bladder, we have the detrusor muscle that contracts the bladder when we want to void, and we have nerves speaking with this muscle, and sometimes these nerves can start to get overreactive and start to fire impulses to the bladder that makes the bladder spasm. So you get a sudden urge that you have to pee and you cannot make it to the toilet. So you start to pee your pants basically. And also an overactive bladder usually results in that you can only hold maybe a half or 1 deciliter urine before your urinary bladder wants to void. So normally the bladder should have a capacity of about 3 to 4 deciliters, but when you have an overactive bladder or urge urinary incontinence, only a little amount of urine makes the bladder start to give these signals that you have to go to the toilet. So these women often go maybe 12 or 15 times during the day to the toilet, maybe every 30 minutes or every hour. And also it's very common that you have to wake up during the night and void. And when we treat this group of women, we usually start with bladder training. Bladder training. And we will speak more about this in another clip. And the next step in the treatment is medication. So there are different kind of tablets that go and affect these receptors from the nerves to the detrusor muscle that makes this bladder muscle calm down. But if you don't get enough effect of bladder training or medication, or maybe you get a lot of side effects from this medication, you have to stop it. Then we have the third step in the treatment ladder, which is Botox. And Botox is botulinum toxin A. And when we inject Botox in the muscle, it makes the muscle paralyzed. So in this treatment, we go inside the urinary bladder with a camera so we can see the bladder. Then we insert a thin needle and we inject Botox in normally 10 different spots all around the bladder. And this usually results in 100 units of botulinum toxin. And this treatment has revolutionized the treatment for women with urge urinary incontinence. And in this video we will see how it goes in practice. And when you get Botox, the effect comes after 1 to 2 weeks. So the day after your treatment you will not feel any difference, but after 1 to 2 weeks the effect will gradually appear. And the effect, we usually say that 1/3 of women who have urge urinary incontinence, which means they pee their pants, will get completely dry. So all the problems will go away. And the majority, up to 90%, will have a good effect and the bladder calms down. So maybe they are not completely dry, but much better. So this is a very effective treatment. And the effect lasts for between 6 to 12 months. So Botox is not a permanent treatment, but you have to go back to your clinic maybe once a year or once every 6 months and fill extra. You get a new treatment. And it's very important to know that you should not give Botox treatment closer than 3 months apart. And if you take Botox for your wrinkles, you have to wait also from that moment 3 months until you get Botox in your bladder. Because if you get Botox anywhere in the body, closer than 3 months apart, your body will start to develop antibodies that blocks Botox. So you will not get any effect in your body from Botox if you get these antibodies. And the risk with the Botox treatment is that sometimes this effect of paralyzing the bladder will be too strong, and suddenly you cannot pee anymore. So you don't have a problem with peeing your pants, you have a problem with you cannot void. So you have to help yourself to void with a catheter. So you insert, it's like a little straw that you insert inside the urethra and into the bladder to help the pee to come out. And approximately 2% of women who get Botox treatment will have this complication. So this is why you have to see a urotherapist or a nurse before your Botox treatment to learn how to catheterize yourself. So if you are one of the 2% who have this problem, you have to be comfortable with the solution. Okay, so this was a little background, and now we will see how it goes in the real life. And we thank Professor Daniel Altman and also the patient for giving us this demo.
So here we see the tools that we need for this treatment. We have some local anesthetic gel to reduce discomfort. We have antibiotics, 1 single dose before treatment. And here we have the Botox itself that is diluted with the saline solution. And we have the cystoscopy equipment here. And this is the long needle that we insert in the cystoscopy to give the Botox injections with. And we have also prepared some saline solution that we can insert in the bladder during the treatment. And we start with cleaning the urethral opening to reduce the risk of bacterial infection. And then we insert the local anesthetic gel in the urethra. And then we will start the procedure by inserting the cystoscopy introducer here. And we let the pee drip out. And now Daniel will insert the camera. And we open the little channel for water or saline to come into the bladder so that we can distend the bladder and have a visual inspection of the bladder. So here we look inside the bladder and we see that everything looks normal, and now we will start the treatment. And here Daniel gets the long needle that he inserts into the cystoscopy channel. Here we saw the needle, and we give 10 injections, and we start in the middle of the bladder in the lower part, and we avoid to put the needle close to a big vessel. So here we do the first pinch with the needle, and we insert Botox 1 milliliter. Then we go 1 step up and we give the next injection. So we stay in the midline of the bladder and we give 4 injections in the midline, from the bottom through the medial part and then to the upper part of the bladder. Then we move to the right side of the bladder, and here we give 3 injections, 1 in the bottom one in the middle, and one in the top. So now we have given 7 injections, and then we move to the left side of the bladder and we do the same procedure, 1 in the lower part, 1 in the middle, and 1 in the upper part. And here we see the assistant that gives the Botox when the needle is in place. So this is a Botox treatment of the urinary bladder. Thank you for listening and watching. Have a good day.